at the Rock Island County Health Department. Today, we will be talking about how to deal with COVID-19 now that the weather is beginning to get nicer. We also will be helping you keep yourself safer if someone in your household has symptoms of the disease. And as always, we are joined by Nita Ludwig, Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. We ask you to please type your questions in the chat box, and the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. As far as the case count goes in Rock Island County, we have 3 new cases of COVID-19 today, which brings our total to 19. Ed, what are Scott County's numbers?
In Scott County, we also have 2 adults between the ages of 41 and 60, an adult between the ages of 18 and 40. That's a total of 21 cases in Scott County. For Iowa, that's a total of 549 cases. The Iowa Department of Public Health is also reporting 6,888 negative tests. So, looking outside, it's a pretty nice day. We need to talk about social distancing and warmer weather. After what felt like a long winter, warmer weather is finally here. And as the stress of COVID-19 has us looking for outlets to manage our stress, physical activity and time outside is a good option. But as difficult as it is to hear, even outside, we still cannot loosen up our physical distancing. This remains important, especially as many individuals begin spending time in the same outdoor areas of our community. Please listen to these messages and do what is needed to keep our community safe. First, stay 6 feet apart from one another when spending time outside. Do not play on area playgrounds. Our city partners may address that later. Do not gather in picnic and shelter areas. Do not gather for pickup games of basketball, baseball, or other sports that involve contact with groups of people. But do find ways to be outside that allow you to stay apart from one another while still enjoying the benefits of the outdoors. We know these aren't easy asks, and we know it probably feels like we're taking away so many of the things that define spring in our community. But these steps that we take will mean the difference between life and death for some in our community. So please help us relay these messages to our community.
We are also joined by a couple of our counterparts here on the Scott County side. We have Lauran Haldeman from the city of Bettendorf. Lauran, do you want to give us an update on the city, please?
Sure. As of yesterday, the city of Bettendorf has closed the Crow Creek Dog Park, the Crow Creek Skate Park, the tennis and pickleball courts at Kiwanis Park and Middle School. The parks, city parks and recreation trails do remain open at this time. Our golf course is still open, and our pickleball courts are still open.
Thank you for that update, Lauran. We also have Sarah Ott with the city of Davenport. Sarah, could you give us some updates on the parks in the Davenport area?
Thank you. So the city of Davenport recognizes that it is important for our citizens to be able to get outside and enjoy the sunshine and the warmer weather as we head into spring. But we also want our citizens to be cognizant of maintaining appropriate social distancing and limiting the exposure of COVID-19 to others while they are doing so. To that end, earlier this week, the city of Davenport closed park structures within our parks, and this includes playgrounds, shelters, basketball courts, tennis courts, and pickleball courts. We also yesterday closed our skate park as well. However, recreational trails, open spaces, golf courses, and disc golf still remain open for the public to use and enjoy during this time. Like I said, we very much still want to encourage people to get outside while also emphasizing appropriate social distancing while doing so.
Thank you very much, Sarah and Lauran. We'll now hear from Nita Ludwig with the Rock Island County Health Department. Nita?
Thanks, Brooke. By now, many people might know someone who is exhibiting signs or symptoms of COVID-19. fever, shortness of breath, and cough. What should you do if you're a caregiver or a family member of someone who's sick? Well, first of all, you can monitor their symptoms. Even if the symptoms are mild, people who are sick should stay at home. However, older adults and those with serious underlying conditions should seek care as soon as symptoms start to worsen. We ask that you call ahead to the person's physician or to the emergency room or dispatch center if their situation is life-threatening. Know the emergency warning signs, which are trouble breathing, persistent pain or pressure in the chest, new confusion, bluish lips or face. You can also assist them with treatment if they're home. Make sure they drink plenty of fluids and stay hydrated. They can also take over-the-counter medicines, which might help with the symptoms, including acetaminophen or Tylenol, and decongestants and cough drops. Also, you can prevent the spread of germs. Have that person stay in their own room and use a separate bathroom if possible. If face masks are available, have them wear a face mask when they're around the other people in the household. Avoid sharing household items like dishes, glasses, towels, bedding, etc. Wash your hands after interacting with them. Clean frequently touched surfaces such as countertops, doorknobs, bathroom fixtures, toilets, phones, and other things. Wear disposable gloves to clean and disinfect. When can they stop self-isolating? Well, people can stop self-isolating from COVID-19 when they meet the following conditions. If they've had no fever for 72 hours, and that's 3 full days of no fever without using a fever-reducing medicine like Tylenol, and that their cough or shortness of breath has improved, and that it's been at least 7 days since their symptoms first appeared.
Thank you very much, Nita. We are going to go ahead and move to the chat. We would encourage you to put any questions that you have for any of our speakers today into the chat, and we will go ahead and read them as they come in. So we'll go on mute here until we receive our first question. Thank you. Okay, we have a first question here. How did city leaders decide which structures to close? Sarah, would you like to answer that question first for us?
Sure. So the city of Davenport looked at a couple of different things when making the decision on which structures to close. The first was, where was social congregating happening, where we saw large groups of people in close proximity to one another. The skate park is a good example of where that was happening, and then, which is why we made the decision to shut that down. But then we were also looking at certain park elements like playgrounds, shelters, sports courts, where people were touching things and where the virus can live on a surface. And so we wanted to help people steer clear of that as well. So we were looking at both where the virus can live on surfaces, but then also where we saw a lot of people congregating within close proximity to one another.
Lauran, did you want to add anything for the thoughts behind City of Bettendorf's decisions?
Sure. It's pretty much the same as Davenport. As far as the skate park and the dog park, we found people with large groups and they weren't following the social distancing rules. And so the decision was made to close both of those. And as far as playgrounds, that was also the case. Where the virus could live, what would be the worst place for children to be at certain times. So that's why they closed the playgrounds also.
Thank you both. We do have an additional question. What regulations are in place at the Iowa golf courses to limit contact? Illinois courses are totally closed. I'm sure Iowa is busy.
That would be those things in the governor's proclamation about social distancing, remaining 6 feet from others, not gathering in groups of 10 or more. I understand from direct reports and some articles that I've read that golf courses are going beyond that by sanitizing and not removing the flags from the holes so that people's hands aren't going in the holes. They're doing just a bump the pin being a hole on many courses.
Can you hear me?
Oh, go ahead.
Sure.
Yes, go ahead, Lauran.
In Bettendorf, we reduced the amount of reservations that we're taking, probably even 25% to control the number of players on the course. We also been disinfecting. We've gone to single cart rental. And right now, and this isn't because of COVID-19, but our golf course is now a 9-hole golf course because of some construction that is being done on the course. So this is the rules that we're following right now.
This is Sarah with Davenport. We're instituting very similar things to Bettendorf as well, including raised cups and staggered tee times to allow for people to not be congregating in such close proximity to each other.
Thank you. Do you have an additional question? Ed, perhaps you can start with this one. What outreach is being done to big companies such as John Deere and Arconic about social distancing? We hear almost daily that they are not following CDC guidelines. Perhaps you can follow up with what the chamber described on Friday.
I know that our staff has been reaching out to the companies. We've gotten some inquiries about whether this business or that business is allowed to operate and why. They, I understand, have been very cooperative, going sometimes beyond our recommendations in the workplace. So we continue to stay in touch with them.
Thank you. If someone lives with a person with COVID-19, should the not sick person stay home as well and treat themselves as possibly infectious? Nita, do you want to take that question for us?
Sure. I would say it kind of depends on the sick person's age. And if it's a small child, of course, that they might need someone to stay with them, a parent or such. But if it is an adult person that is ill and you're caring for them, if you are not symptomatic, there is no reason that you need to stay home as well. You can continue working or doing the things that you need to do.
Thank you, Nita. Will Scott and Rock Island counties take measures to disinfect public places, parks, and buildings such as city halls? Nita, do you know what the Rock Island County has done with their facilities at this point?
Yeah, I do believe that all of the maintenance workers, certainly in our building here at the health department and the other county buildings as well, they are ensuring that they clean and disinfect routinely, regularly, all those touch surfaces, doorknobs, light switches, keyboards, all those sorts of things. Maintenance is continually disinfecting and cleaning.
Ed, would you like to share for Scott County, please?
Yes, the Scott County Public Buildings, Administration Building where we work, among them are closed to the public, and the facilities and support services staff are doing extra cleaning and sanitizing of frequently touched objects like door handles and light switches and the like to keep the building safe.
Thank you. Are there any updates about the virus itself as to what doctors and scientists are learning about it and its contagiousness and treatments? Ed?
There are articles published nearly every day with new insights on it. I would encourage you to get on the internet and search places like PubMed and MedArchive to find articles that are current. I think you'll find that there's a large research effort underway to understand the virus and to keep current.
To the next question regarding the virus, it says this may have already been before, but what criteria do patients need to meet to be tested for COVID-19? There seems to be some misconceptions in the community about who can be tested and why. Nita, do you want to start with Rock Island County on that?
Sure, and this is very fluid. It has changed a few times, but we are following the Centers for Disease Control testing guidelines as well as the Illinois Department of Public Health laboratory guidelines. And it's basically if people are symptomatic and they're being admitted to the hospital for those lower respiratory illnesses like pneumonia, they are a candidate for testing, as well as symptomatic folks that come from congregate care settings such as nursing homes, assisted living, those sorts of things, and healthcare workers who are symptomatic.
Ed, can you respond to that for Iowa, please?
Here, there are two frameworks in Iowa. If it's a private lab, then the provider sets those guidelines. If it goes to the state hygienic lab, this is their criteria. The ones who are eligible for testing are all hospitalized patients of any age with fever and respiratory illness. Older adults, 60 years of age or older, with fever and respiratory symptoms. Persons of any age with fever or respiratory illness who live in a congregate setting, that is, long-term care facilities, dormitories, residential facilities, correctional facilities, and treatment facilities, and healthcare workers, essential services personnel, first responders, and critical infrastructure workers with fever or respiratory illness. For example, healthcare workers, fire and EMS, law enforcement, and residential facility staff.
And that guidance continues to come out from the Iowa Department of Public Health and sent out to providers. We have one additional question that I would put to Sarah and Lauran. What about cleaning structures and parks? Will passage of time take care of that? I know you said you've closed them, but has this been a discussion that has come up?
This is Sarah. At this time, the city of Davenport is not disinfecting park structures.
That's the same for Bettendorf also.
Okay, thank you both. We'll give it another 30 seconds. If there's any additional questions, please type them into the chat for any of our speakers here. We're going to restate the Scott County case numbers just to make sure it was out there and the information is correct on there. Go ahead, Ed.
The announcement today was for 3 cases, 1 person between the age of 18 and 40, 2 between the ages of 41 and 60, for a total of 21 cases in Scott County.
Okay, seeing as there's no additional questions being typed into the chat, well, thank you all again for your participation. Thank you to the partners who joined us on the call today and helped provide information for the public. We again appreciate your assistance in providing this information through your media channels to those who live in our area to help keep our community safe and help to minimize the spread of COVID-19. We look forward to hearing and talking with you again later this week. Have a nice day. Thank you.